Transfusion reactions are reactions that occur when the donor's blood type from a blood transfusion does not match the recipient's blood type. If the recipient's immune system attacks the red blood cells, it's called a hemolytic reaction. There are two types of hemolytic reactions, intravascular and extravascular. Your body can tell self from non-self. If you receive blood that is not compatible with your blood type, your body will produce antibodies to destroy the donor's blood cells. There is type A, B, AB, and O blood types. Blood cells contain protein markers corresponding to these different blood types on the surface of the cells. In the serum of certain blood types, there are antibodies that act against incompatible blood types. For example, if someone with type A blood were to receive blood from a donor with type B blood, the antibodies in the recipient's blood would react with antigens on the surface of the donor's blood cell. This leads to complement fixation and lysis of the cell. In extravascular hemolysis, the donor's red blood cells are removed from the body by macrophages in the liver and spleen. The macrophages destroy the red blood cells inside these two organs. The donor red blood cells may still be coated with the recipient's antibodies, but these antibodies do not trigger an immediate intravascular hemolysis. Their presence, or the marker, is recognized by receptors on the macrophages, which aids phagocytosis of the cells. Some patients also experience allergic reactions to the blood transfusions. This is common in patients who have a history of allergic conditions. Patients report feeling itchy and break out into hives. Symptoms include back pain, bloody urine, chills, fainting or dizziness, flank pain, flushing of the skin, and fever. Transfusion reactions are rare. Even when an individual receives the correct blood type, they can sometimes experience a transfusion reaction. These reactions can be mild or severe. There are complications that are associated with blood transfusion reactions. Mild complications include pain and fever. Severe complications include acute kidney failure, anemia, lung problems, or pulmonary edema, and shock. So what happens if you experience a transfusion reaction? Transfusions are immediately stopped if a recipient experiences a reaction. The immune response associated with transfusion reactions is a temporary one, since it only occurs when incompatible blood is transfused into a recipient's body. Outcome depends on how bad the reaction is. Some symptoms can be mild and can be treated with acetaminophen to reduce pain and fever. Doctors can prescribe intravenous fluids and medications to reduce the likelihood of kidney failure and shock. For those who experience an allergic reaction, antihistamines are given to control symptoms.